Healthcare for Syrian refugees in Turkey now goes beyond any physical injuries. Last month, the aid group Relief International partnered with the government to open a mental health care center in the capital, Ankara. Treatment is free. Ahmed al-Mohammed fled first from airstrikes in Aleppo and then from Raqqa after the rise of Daesh.
We need this centre because my kid's situation was bad when we came here, and not just my kid, even me. I had a psychological problem because of what happened to us in Syria.
Ahmed is one of more than 3.5 million Syrians forced to seek refuge in Turkey. The World Health Organization says almost 750,000 of them suffer some form of trauma, ranging from mild to severe. This facility in Ankara is funded through the EU and has psychiatrists, psychologists, and counselors specializing in anxiety, psychosis, depression, PTSD, and more. It's also the kind of care that is crucial for children. Rana Awad says the treatments for her little girl have been effective.
If you give her something, she knows what it is. She's starting to understand more. Her abilities are really improving.
The Ankara Center, modeled after a similar clinic in Gaziantep, expects to treat 825 patients through February 2019, when its funding ends. But EU authorities say this is the project's second phase, and others are planned with future donors. The center is part of a national program aimed at expanding into Istanbul and Kilis. And services aren't just for Syrians. Organizers want news of them to spread to all of Turkey's refugees.
So the challenge more is to identify and explain to people that this service exists, that they can access it, and that they can find professional care so that they're not left alone. They're not alone in their situation.
Ike also says that Syrians are not just victims. Many play an active role in Turkey, helping other refugees. Several are on the center staff and are part of the healing process for their own people. Sarah Balter, TRT World.